Why is your baby crying nonstop? For many parents, endless crying can feel overwhelming and worrying. One common reason behind this is colic. Colic is frequent in infants. It's stressful for both the baby and the parents, but the good news is that it's usually not dangerous. In this video, we'll go through 5 clear signs that can help you recognize colic pain in infants so you can better understand what your baby might be going through. One of the biggest signs of colic is crying that feels different from normal. Babies with colic may cry for hours at a stretch, often in the evening or night. This crying is not the usual hunger or sleepy fuss. It is louder, sharper, and more intense. Parents often describe it as screaming rather than just crying. What makes it even more stressful is that soothing methods like feeding, rocking, or holding don't seem to calm the baby down. If your infant cries intensely for long hours and is difficult to comfort, colic might be the reason. Sign number 2, clenched fists and tensed body. Colic isn't just about crying. The baby's body language tells the story too. When a baby has colic pain, they may clench their fists tightly, pull their legs up toward their tummy, or stiffen their whole body. Sometimes their stomach feels hard to touch because of tension and trapped gas. These physical signs show that the crying isn't just fussiness, but is related to abdominal discomfort. Watching your little one tighten up and distress can be heartbreaking, but these tensed movements are a clear signal of colic pain. Sign number 3, gas and abdominal discomfort. Another common sign of colic is excessive gas and tummy discomfort. Many parents notice that their baby's stomach looks bloated or swollen during crying spells. The infant may pass gas frequently or seem uncomfortable while trying to do so. Interestingly, some babies appear more relaxed after passing stool or gas, which indicates that abdominal pressure was bothering them. Colic doesn't mean your baby is sick, but their immature digestive system may be struggling. If your baby cries, wriggles, and shows relief after releasing gas, it's likely part of colic pain. Sign number 4, predictable timing. Colic often follows a predictable pattern. Parents notice that the crying spells happen around the same time every day, most commonly in the late afternoon or evening. These episodes can last for 3 hours or even longer, and they may occur at least 3 times a week. The regularity makes it different from normal fussiness, which is more random. If your baby seems fine during the day, but suddenly becomes extremely fussy at the same time each evening, this predictable timing is one of the strongest clues pointing to colic pain. Sign number 5, trouble sleeping and restlessness. Babies with colic don't just cry, they also struggle to sleep. During colic episodes, your baby may find it very difficult to fall asleep, or if they do, they wake up frequently, still fussy and unsettled. Even after feeding, they may not appear satisfied or calm. This restless pattern can leave parents exhausted too, since both day and night sleep get disturbed. Unlike babies who wake for hunger and then return to sleep easily, colicky infants often remain cranky and hard to settle, showing that discomfort is keeping them awake. When to see a doctor, while colic is common and not usually dangerous, it's very important to know when to seek medical help. If your baby's crying is extreme, they refuse to feed, vomit frequently, or develop a fever, don't assume it's just colic. These can be signs of more serious conditions that require urgent attention. A pediatrician can rule out other health problems and guide you with the right care. The good news is that colic usually improves on its own by 3 to 4 months of age, but always keep your doctor involved if you have concerns. Summary: closing colic can be one of the hardest phases for new parents, but remember, it's tough, not permanent. The 5 key signs to look out for are intense nonstop crying, clenched fists and body stiffness, gas-related tummy discomfort, predictable crying times, and restless sleep. While exhausting, these signs usually fade with time. With patience, soothing techniques, and proper guidance, things do get better. If you're going through it now, hang in there. Your baby will outgrow colic, and calmer days are ahead. You're not alone in this journey.